Welcome to my assignment in Concepts in Pharmacology. My student ID is u3274370. The allocated drug was donepezil hydrochloride. This drug is an acetylcholinesterase inhibitor which is used to treat behavioral and cognitive effects of Alzheimer's disease and other types of dementia. Let's have a look at the pharmacokinetics. Absorption. Donepezil is slowly absorbed via the GI tract, the gastrointestinal tract, after the oral administration. Tmax is 3 to 4 hours with a bioavailability of 100% and a steady state concentration are attained within 15 to 21 days. The Cmax of 5 mg donepezil tablet is estimated to be 8.34 ng per mils. Distribution crosses the blood-brain barrier, widely distributed in the central nervous system. Plasma protein binding is 96%. Metabolism. Donepezil is metabolized by first-pass metabolism in the liver, primarily by CYP3A4 and CYP2D6. Some active metabolites contribute to the drug's effect. Excretion. Excretion through urine as 57% and fecus as 15%. Half-life approximately 70 hours, supporting once daily dosing. Now, let's see the pharmacodynamics. The pharmacodynamics of donepezil hydrochloride involve its role as a selective reversible inhibitor of acetylcholinesterase, the enzyme responsible for breaking down acetylcholine in synaptic cleft. By inhibiting the enzyme, donepezil increases the concentration of acetylcholine in the brain, enhancing the cholinergic transmission. This action helps to improve the cognitive function and alleviate symptoms of Alzheimer's disease such as memory loss, confusion, behavioral changes. Donepezil's effects are primarily centered on the central nervous system, targeting areas involved in memory, cognition, and additionally, it may have secondary effects such as modulating NMDA receptor activity and neuropathic effects. Let's have a look at the molecular target affinity. Binding to the target, donepezil binds with the affinity to acetylcholinesterase, inhibiting the enzyme's activity, and as a result, it prevents the breakdown of acetylcholine, leading to increased levels in the synaptic cleft. Let's have a look at the mechanism of action. Increased acetylcholine enhances the cholinergic neurotransmission, which is impaired in Alzheimer's disease. Drug response. Efficacy. This improves the cognitive function, memory, and the ability to perform the daily activities in patients with Alzheimer's disease. Onset. Clinical improvement may take several weeks. In long-term use, this may slow the progression of symptoms but does not cure the disease. The SUSMP schedule of this drug is Schedule 4, and that's a prescription-only medicine. And the legal considerations are prescribed only by a qualified healthcare professional and must ensure patient consent, particularly for long-term use. Prescribers, general practitioners, geriatricians, or neurologists, and the pharmacist can dispense the medication, monitor for drug interactions, and provide counseling. Nurses administer the drug and monitor for adverse effects. Allied health, speech, and occupational therapists monitor cognitive or functional improvements. Counseling and considerations. The side effects are nausea, vomiting, diarrhea, muscle cramps, insomnia, bradycardia, and gastrointestinal bleeding. How to use. Take once daily before bed. It can be taken without or with food, but best to avoid heavy meals. Refer to a specialist for heart issues or if side effects persist. This is a detailed picture of the physiological effects. Let's have a look of our PowerPoint presentation as a quiz. What enzyme does donepezil inhibit? The answer is acetylcholinesterase. And how long is the donepezil's half-life? The answer is 70 hours. What is the primary clinical use of donepezil? It's used for Alzheimer's disease. Here are my references, and thanks for listening.